Hello, I'm Mercedes Stevenson, and this is the West Block, politics, perspectives, and players. More than 50 countries are reporting cases of COVID-19 as the battle to contain the virus intensifies. Here in North America, many schools are preparing for a break this month, leaving parents to question the risks of that much-desired vacation. Have we reached the tipping point for coronavirus, and can it be stopped? Joining me now is Dr. Marcos Espinal, the director of the Department of Communicable Diseases and Environmental Determinants of Health at the Pan American Health Organization. Thank you for taking the time to talk to us, Dr. Espinal.
My pleasure.
Each week we are hearing about more and more cases and countries reporting COVID-19 now within their borders. A lot of people are wondering, at what point does this meet the criteria to become a pandemic?
Well, that is a very important question, and there is a fine line that we could cross any time. The pandemic issue, it has pros and cons, because the word pandemic can create also fear, stigma, and can also suggest that the international community cannot contain this virus. On the other hand, we firmly believe that it is a pandemic when we start observing sustained transmission in the communities. We have seen that in 3 countries so far: Italy, South Korea, and Iran. So we are watching this critically.
And how prepared do you think we are here in Canada, the United States, and the Americas for this virus?
So the health systems are really not homogeneous in terms of preparation. So there are stronger health systems, others are weaker. Canada and the United States has very strong health systems. I think Canada has done very well. Canada also has a lot of experience on the past coronavirus like SARS, and I think Canada has been able to handle the cases that have arrived related to China very well.
So far, the cases we've had coming into Canada have been people who have been in contact with somebody who had contact with someone in China, a spouse of somebody who had it. But when you really start to worry is when you start to see community transmission, that transmission of the disease to people who have not been or had a close relationship with someone who is considered to be high risk.
That is correct, and that is the key issue for calling it a pandemic event. We don't rule out that it's going to be called like that, you know. We also don't rule out, like, for instance, in China, cases are declining, that it could come back. But as the Director General was saying a couple of days ago, the organization still think that it can be contained.
What about places like Africa, where there is now a case in Nigeria, where there is not the kind of healthcare system that European and North American and many Latin American countries have? Once it reaches there, does it become much harder to contain it?
There is no doubt that Nigeria will be committed to try to contain this. We have an office for the whole of Africa, and certainly we're working with them. But I agree with you. There are several countries there where the health systems are weak, and they need to be strengthened.
Even in the United States, in California, they were talking about a shortage of testing kits. Are you concerned about whether or not even countries like Canada and the U.S. are really prepared for this to come and for the healthcare system to have to deal with it?
One thing is containment, and the other thing is mitigation. And mitigation measures can be implemented when we have outbreaks or community transmission.
A lot of Canadian families are getting ready to go on their March break. They tend to go away. People travel, they fly, they go to places where there's lots of people, like theme parks. You know, should Canadian families be concerned about that, and should people be rethinking potentially their plans for the break, or just carry on?
Well, that's an important question. I think the key issue is to watch how this evolves and make the best decision close to the vacation or so. I mean, some countries are already recommending canceling mass gathering events. But it depends on the country itself. You know, each country within their boundaries can recommend what they consider is good for their citizens. One thing is clear, that is there is community transmission in a place, and it's important to avoid that place. I mean, for the time being. But if the vacation is in 2 months or so, I recommend watch and see how these evolve. If they see more cases coming into the vacation or holiday place, then it would be recommended, it would be better to postpone that traveling, because protecting life is more important than being on holiday.
So for people at home watching, what should they be doing to protect themselves, both from preventing getting the virus, but also dealing with a situation where there is an outbreak and things could change in terms of ability to get out of the house or use public transit or go shopping?
I think the important issue is not to create panic. The purchase of extra supplies is related to what I said earlier. If an influx of cases arrive in Canada, the authorities need to be prepared with stocks of supplies, protection equipment, and so on. But they're not saying this is because the risk is high or low. I think this is called preparedness. I mean, to make sure they have the equipment needed and the supplies needed to face a major influx of cases. I think the issue of low risk versus high risk is also depend on the health system of the country. But nobody can control a virus like this. Nobody can predict, I'm sorry, what is going to happen. But we can also say that it's going to be Armageddon or something like that. I think countries are preparing, and Canada is one of them. And we fully are confident that Canada is able to do good preparation for facing cases of coronavirus, like they have done already so far.
Thank you very much, Doctor.
Thank you.
That's all the time we have for today. For the West Block, I'm Mercedes Stevenson. Thanks for joining us.